Hi, my name is Kaylin Nix. I'm a rising senior in the Department of Molecular Biology, and I'm also pursuing a certificate in global health. This summer, I was a virtual intern at the Children's Hospital of Philadelphia, specifically working with Dr. Richard Aplink and his research team in pediatric oncology. His team is actually part of the Children's Oncology Group, which is a national network of researchers in the field of pediatric oncology. Specifically this summer, I was working on a project that was related to some of the side effects of chemotherapy that decrease the survival rate in AML, or acute myeloid leukemia. A common side effect is cardiotoxicity. So there's a weakening of the heart and the thickening of the cell wall, and that has been associated with decreased survival outcomes. But it's unclear as of now whether that survival outcome differential is due to a direct result from cardiac issues or failure, or whether that is an indirect result as physicians decrease the amount of chemotherapy given when the children start to display weakened hearts, and that leads to increased relapse and refractory disease. So this summer I was helping them kind of investigate this problem by performing some data abstraction from the electronic health records of thousands of children across the country that were enrolled in the AML 1031 clinical trial. So this data that was pulled is measurements from the echocardiograms taken over the course of treatment of these children in the trial. And they hope to use this going forward to kind of explore a little bit better the mechanism by which this cardiotoxicity is impacting AML survival in kids. And the project is still ongoing, so my efforts contributed to future projects, but there's still some more work to be done. Like I said, there's thousands of patients, so there's a lot more abstractions to be done. But what's really cool about this data set is that it's super granular, so we have a lot of data, all of these measurements that a lot of other clinicians don't have, so we're hoping that this will give insight into this mechanism. And I also worked alongside another intern to help write a case report about the use of a certain CAR T-cell treatment as a bridge to therapy when children with acute lymphoblastic leukemia face severe infections. So infection is a really common issue with children who are immunocompromised. And specifically, we had two patients that had really rare infections, tuberculosis of the brain, and a really rare mold. And the doctors were able to successfully treat their leukemia while also their infection. So the other intern and I are currently writing up a case report that we hope to get published by the end of the year, so that other doctors who are facing these difficult situations as well will be better informed. Overall, this summer experience was super meaningful. I really, really enjoyed working with the team. I loved working at CHOP. Last summer, I also worked at a children's hospital. I just really loved the feel. I was able to attend some of the virtual grand rounds and tumor boards. And so I felt like I was still able to explore other aspects of the hospital besides my research group, which was really amazing. I loved working in a small group. I loved working with other interns. Like I said, I'm collaborating with one now for a publication. So it's been really great. And I also hope to continue the relationship with this lab in my senior thesis work as I'm looking at racial disparities in survival of children with ALL, acute lymphoblastic leukemia, and CHOP, specifically Dr. Aplink's lab, has a really great data set that might be useful for that. So hoping to keep those doors of communication open. And it's also further affirmed to me that I want to do research in my career in medicine. So that was really great to talk to someone who had done an MD PhD in a kind of non-traditional way, but also talk to a PhD epidemiologist who was also in the lab, Kelly Getz. Yeah, so it was a really great experience. Even virtually, I still felt connected. I still felt like I got a lot out of it. I learned a lot. I learned how to write a case report. I learned a lot about data abstraction and just clinical oncology and research in oncology in general. So I'm very grateful for the experience. Thank you so much to the Center for Health and Wellbeing for contributing funding to that. And yeah, that was my virtual experience.